I'm Georgia White, GP at North Croydon Medical Centre.
Why do you feel you have such high levels of accuracy at your practice?
As a GP partner, I'd read the document that NHS England or the Department of Health had sent down to us in regards to the primary care contract. And within the contract, it stated clearly that we do not ask patients for documentation. We're just meant to register patients. If we decide on asking for that documentation, it must be consistent across, meaning asking all patients for the same thing. However, if we did that, then there'd be barriers to patient being able to access care. The homeless patient, the drug addicts, you'll find most of them homeless meaning they would not have a home. Some drug addicts as well have never had documentation, meaning about their births, about passports. So we endeavoured to stick to not asking for anything, going by what the primary care contract states. One of the things we looked at recently was the actual name of what does the NHS mean. The NHS means National Health Service, but most times what we have been doing is offering care. So rather than it be National Health Service, we've been offering National Health Care. So as a practice, we decided we're going to change this. We're going to change it to a service-driven practice rather than a care-driven practice. So as a group, we decided to get a trainer in to go over the different elements of a service. And one of the things we were taught is that service lost is difficult to recover. So what we've aimed to do is to ensure that we're not retrieving service, but we're giving it the first time round.
So in response times, you were well below the average for Croydon. Why do you think this is?
2 years ago, we decided to install more lines so that patients could get access to the service more readily. We had 8 lines before, which we then changed to 10 lines, with 4 being solely accessed by patients and not by anybody else. Prior to 2016, we had 7 lines within the surgery. What we did, we thereafter realized that patients were complaining that they couldn't get access to the surgery. So we've increased the lines to 10 lines, with 4 being totally dedicated to patients gaining access to the surgery. We've also employed more staff to be answering the phones, and one of the things we've done as well, we've trained reception staff that when the phone rings, after about 3 rings, then they should pick up. They should not have the phone ringing more than about 3 rings.